Welcome back to Deadline DC with Brad Bannon. I'm Brad Bannon. My guest in this half hour is Natasha Murphy, who is Director of Health Policy at the Center for American Progress. Before we get to Natasha, we're going to play this clip where we have Republican Congressman Brian Fitzpatrick talking about the GOP attitude towards healthcare insurance.
Well, I say that if you don't have a better plan, then get on board with ours. But doing nothing is not an option, right? I mean, I've heard so many people in the Republican conference rail on the Affordable Care Act, rail on Obamacare, rail on the premium tax credits. And if you want to criticize something, that's okay as long as you have a better alternative. They have never offered a better alternative. We went down this healthcare path in my freshman term. I voted against the repeal of the ACA. I thought the replacement was insufficient. It was hastily put together, not well thought out. And here we are, 8 years later, and they still have not been able to put together an articulable plan that's going to work for everyday Americans. So, is the premium tax credit structure perfect? No, it's not. I don't like the fact that there's no income caps. I don't like the fact that the money all goes to the insurance company and rather than having some go to the individual. But right now, with a cliff upon us at the end of the year, I think we have to extend it out a minimum of 2 years with guardrails, with income caps.
That was Republican Congressman Brian Fitzpatrick criticizing his own party, the GOP, for failing to come up with an alternative to the health insurance tax credits under the Affordable Care Act. Our guest in this half hour is Natasha Murphy, Director of Health Policy at the Center for American Progress. Welcome to Deadline DC, Natasha. We're glad you could be with us today.
Brad, thank you so much for having me. Always a pleasure.
First of all, will you explain to our audience, this is a complicated area, which is why we have you on today. What is the Affordable Care Act? What does it do?
Yes, so happy to help level set for the listening and viewing audience. So, as many are likely aware, the Affordable Care Act was a landmark piece of legislation that was passed in 2010 that really changed the American insurance landscape. And so one of the most notable things about the ACA was that it created these health insurance marketplaces where individuals who don't get insurance through their employer and who previously kind of really were on their own trying to find coverage and oftentimes struggled because their premiums were so unaffordable or they had a pre-existing condition that, allowed insurers to deny them coverage. But post ACA, you had these marketplaces that were created. And so every year during the open enrollment period, individuals who buy coverage on their own will log on to healthcare.gov or their state-based marketplace to shop and compare plans for the upcoming year. And so currently, we are in the midst of that shopping cycle. It kicked off on November 1st, and we have a few more weeks to go. But one of the things, Brad, that is kind of right now at the center of the health policy conversation, and honestly, more broadly, the federal policy conversation, is a battle around the extension or lack thereof of these enhanced premium tax credits. And these were tax credits that were introduced about 4 years ago, and they helped make premiums more affordable for a broader swath of Americans who buy their coverage through the ACA. And so it helped to, significantly lower costs. And because of that, we saw a record number of people enroll on the marketplaces really for the past 4 years. And they are slated to expire at the end of December. And as you can imagine, that is honestly going to be a catastrophe. We are going to see folks have their premium costs more than double in some instances. And in this broader affordability crisis, there's huge concern that without some type of federal or congressional action, we are going to see millions of Americans lose coverage in 2026 and beyond.
Let me ask you this question, Natasha. Do you know roughly how many bankruptcies in the United States are caused by people who can't, essentially, sell their houses, double mortgages on their house to pay for their healthcare expenses? You're always hearing about healthcare bankruptcies? How prevalent is that?
Yeah, great question, Brad. So I don't have the exact number at my fingertips, but I do know that medical debt and healthcare costs are actually the leading cause of bankruptcy in the US and has been for quite some time. Unlike, so many other services, for the most part, healthcare is not particularly shoppable. When you need to see your doctor or in an emergency, you're not taking the time to, check to see, well, what's the cost of an MRI at hospital A versus hospital B? When you need those services, you need them right then and there. And so, therefore, patients tend to be at the mercy of, their doctor or a health system, or in this case, sometimes the insurance company, that the price that's set is honestly the price that we end up paying. And as a result of that, so many of those prices are unaffordable due to a variety of different reasons, ranging from, the lack of competition in the healthcare space, all the way down to prescription drug costs. But overall, healthcare and the lack of affordability is a primary concern for Americans across the country.
Well, let me ask you this blunt question, Natasha.
Yeah.
Are there people in the United States who die because they can't afford health care?
Yes, it is such an unfortunate reality, Brad. Honestly, so many millions of Americans lack insurance coverage as a whole. And the reality is, just because they don't have insurance doesn't mean that they don't have healthcare needs. And oftentimes they know that they're not going to be able to afford to see a doctor. And so they will wait until, the condition worsens, or, they find themselves in an ER. And oftentimes, that delayed care, that care that's been put off, leads to, really worse outcomes. And, in the worst instances, it does lead to unnecessary and unavoidable deaths.
Okay. Um, the let's take Canada. Canada has a national healthcare insurance program.
Yes.
Is, does that national healthcare system they have prevent some of the horrible things that happen in the United States because people can't afford to buy it? On, other hand, people criticize we can't, put healthcare in the completely in the hands of the government. Could you speak to that, please?
Yeah, absolutely. So yes, with the United States kind of being the only developed nation that does not have, a national health service, oftentimes, folks will compare our fragmented system to places like Canada, or, the litany of countries in Europe that have, these more centralized universal coverage models. And there's certainly trade-offs. So one of the biggest benefits of, a centralized or nationalized health service is the fact that people do not have to worry about having health insurance coverage. When they go to see their provider, they are not concerned about, receiving a bill on the back end or having to pay, a co-insurance amount or a copay. And so it really, having that coverage helps to improve access. Now, there are certainly challenges that exist in a nationalized health service. There's concerns around kind of provider compensation, as well as things like wait times, particularly for services that might be viewed as elective or not as urgent. But overall, I would certainly take a system where everyone knows that they have health insurance so that they have access to a doctor when they need one, as opposed to, some of the current challenges of our system where we have folks who lack insurance altogether, or, people who have insurance technically, but they can't use it because of the fact that it is so unaffordable.
Okay. Let's what is, for the sake of argument, do you happen to know, we're talking everything, prices for everything are going up these days, which is a
Yes.
major problem for the president, even if he doesn't recognize it. Maybe I shouldn't
Mhm.
tell him. No, I want him to do something about it. How bad is healthcare inflation?
Yes, healthcare costs as a whole have been steadily rising. And like you mentioned, similar to the costs of really every other good and service, we are seeing significant increases in healthcare costs and insurance costs as well in 2026 and beyond. And so some of this is driven by things like tariffs, it's driven by things like utilization, and some of it is just the overall inefficiencies in the US healthcare system.
Okay. We're going to have to take a brief break here to let our radio listeners have a little vacation. But we're going to continue this interview for our online viewers. And again, if you're listening, I encourage you to watch us online. Uh, but anyway, our guest in this half hour is Natasha Murphy, who's health policy director at the Center for American Progress. We're going to come back, and when we come back, we'll talk about the proposals that are before Congress to solve this problem. We'll be right back right after this break with more talk about healthcare policy, cost inflation, and the prospects for remedying the problem. Welcome back to Deadline DC with Brad Bannon. My guest in this half hour is Natasha Murphy, who's Director of Health Policy at the Center for American Progress. Natasha, let me ask you this question. If Congress does not take action on health care there's a deadline we're facing. Could you talk about the deadline and the consequences for failing to meet the deadline?
Yeah, sure, Brad. So, yes, we right now are staring down the cliff of pretty much a premium affordability crisis. And so, before our legislators leave Washington and return to their respective districts for the holiday season, it is imperative that they take action. The time really is now, because the reality is the enhanced premium tax credits will expire on December 31st, 2025. And so, that means on January 1st, 2026, for people who have ACA coverage, their premiums are going to be locked in, and those premiums, like I mentioned, are going to be significantly higher. We are talking about instances where people are going to see their monthly
I've heard
costs
that
double.
insurance premiums might go up 20 or 30% for some people. Is that
Yes,
true?
yeah. The folks over at KFF did an analysis seeing 114% increases in some cases. And so that's hundreds to thousands of dollars a month for about 20 million Americans who currently rely on these enhanced tax credits to keep their premiums affordable and low.
Uh, it seems to me if you look at the history of the Affordable Care Act, which was created by President Barack Obama, often known as Obamacare, and a Democratic Congress. I remember the days where the Affordable Care Act proposal was under a lot of fire. It was unpopular, but after Congress passed the president's proposal, it's become more popular the longer it's been in existence. And, one of the things that I wonder about is Republicans are considering, there's that old country music song, you miss your water until your well runs dry. Well, I wondered what kind of political backlash do you think there'll be if the Affordable Care Act essentially is voided by the President Trump and the Republican Congress?
Yes, Brad, like you mentioned, the ACA has become increasingly popular over time. Turns out people enjoy being able to afford their health insurance premiums. They enjoy not being able to be denied just because they have diabetes or have survived cancer. They enjoy the fact that, their children can stay on their plan until they're 2026. So there's so many really popular provisions of the ACA that changed and transformed how health insurance is administered in this country. And then even when we look at something like the enhanced tax credits, when you take a look at the country and you see, what are the areas that are benefiting most from this improved affordability, it actually tends to be in Republican districts. Places like Florida, you have millions of, marketplace enrollees who have only benefited from having these lower premiums. And so there's
Natasha,
certainly going to be.
sorry again. I'm going to have to rudely interrupt you so we can bring back our radio listeners. We'll have more of Deadline DC with Brad Bannon right after this very quick break. Welcome back to our radio listeners. We missed you, and we're glad you're back. Guests in this half hour of Deadline DC with Brad Bannon is Natasha Murphy, who is Health Policy Director at the Center for American Progress. Natasha, let me ask you this. The president has been promising to unveil his own healthcare insurance program ever since he announced he was running for president the first time in 2016. Has he ever got around to it?
No, honestly, we have not seen a tangible proposal from the White House to address healthcare, whether it's in the ACA or even more broadly. And that's been a huge disappointment. Like you mentioned, clearly it was supposed to be a priority on the campaign, but now that the president's in office, healthcare just does not seem like it's at the top of his agenda.
Is there a Republican proposal in Congress now as
Yes.
for an alternative to the Affordable Care Act? And if so, what is it?
Yeah, so just today, there has been a flurry of activity, particularly coming from Senate Republicans who are each trying to, share their policy proposals as an alternative for what the marketplaces will look like in 2026. All of these proposals that I've seen, they actually allow the enhanced tax credits to expire. So we're looking at those premium increases that we talked about before. But also, what Republicans are proposing are health savings accounts. Basically, they would take the money that's being used right now for the tax credits and funnel them into HSA deposits. And honestly, these are policy proposals that we've seen and heard before during the last round of, kind of the attempt to repeal and replace the ACA. And the reality is, HSAs are not beneficial for everyone. They disproportionately benefit higher income households who have the funds to actually, make deposits into these savings accounts. But beyond that, HSAs do nothing to address monthly premium costs. And that's what the tax credits are designed to do. And so the solution that I've seen floating around today actually does not solve the problem, which is, millions of Americans facing these significantly higher premiums beginning in 2026.
Okay. Uh, Let me ask you this question about the current state of Congress. Uh, is uh, is there enough support in either house? And I think I know the answer to this. Is there either support in either house, the House or the Senate, to continue the subsidies under the Affordable Care Act, or have the Republicans' control of the House and the Senate made that impossible?
Yes, at this point, we are expecting actually a vote on Thursday on this very topic. And despite the Republican proposals that came out today, and then I know the Democrats last week released some legislation calling for a 3-year extension of the tax credits, the numbers just don't seem like they're there on either side. I doubt that there will be enough votes, any type of bipartisan activity to pass the Democratic proposal. And then, given the quote that we even heard earlier from Rep. Fitzpatrick, I don't think that there's going to be enough Republicans to support the proposal that was released earlier today.
Is We heard a clip at the beginning of the interview with Congressman Fitzpatrick from Pennsylvania, who seemed to be arguing to extend the ACA credits, tax credits. Are there other Republicans who feel that way?
There are, yes. There's a handful of folks. Again, I've seen some quotes from individuals, in New Hampshire, as well as some folks in Florida, recognizing that it is going to be their constituents who ultimately are going to be harmed and bear the brunt of a lot of these premium increases. And so there is a lot of discord, particularly on the Republican side, on whether the tax credit should be extended. If so, how? I heard Rep. Fitzpatrick talking about guardrails. So there's just a lot of confusion and a lack of clarity about where we go from here.
Okay. Now in the Senate, because of the Senate's arcane rules, you essentially need 60 votes to pass something. Is there any hope that you can wrangle 60 senators into voting for ACA continuation and expansion for 2 or 3 years?
Honestly, I am not particularly confident about, kind of reaching that 60 number. The gridlock here in Washington has been terrible, and honestly, it feels like it's only getting worse. And again, it is going to be the American public that pays the price for the lack of congressional action.
Has the Donald Trump made any indication if he favors what he favors as an alternative? I know the Republicans have a plan, sort of. Has Donald Trump said what he wants?
Brad, this is a rare occasion where the president has been largely MIA. Right before Thanksgiving, there was chatter and talk that, he was going to release a proposal coming from the White House. And I think that that would have included actually a 1 year extension, giving folks time to, identify the ideal policy solution. But that was walked back almost immediately because it seemed like, House Republicans were not a fan of it. And so the lack of leadership coming from the White House, I think, also explains why there is such a lack of traction on this issue.
I'm a Democratic political strategist, so I will give you my take on what the impact might be if Congress fails to act. Uh, I spend too much time reading and analyzing national polling data.
Mm.
And what I see in the national polling data is inflation is by far the most important issue to voters as we go into the 2026 and the midterm elections about a year from now. I also see that after inflate general concerns about inflation, healthcare costs are also a big deal. And the final piece of the puzzle is right now, Donald Trump's job approval rating for dealing with inflation is about 40 points underwater. That's 4-0. And I put the pieces together in my own humble way, and I see a political disaster developing for the GOP if they don't do something to solve this problem. Do you agree with that sentiment, or am I way off? It wouldn't be the first time.
I definitely agree with that sentiment, Brad. Honestly, with healthcare being a primary issue for Americans and for voters as we stare down the midterms, folks are not going to forget which party it was that caused their health insurance premiums to skyrocket.
Okay, let's try this. Uh, and I don't, I guess you don't know what's going to finally play out in Congress. We have our hopes. And I'm certainly no expert on how Congress works or doesn't work. Let me ask you this, and this is probably a question for the future, but let's say let's be optimistic here and say Congress passes an extension of the Affordable Care Act and the president actually signs it. Uh, Americans, even with the Affordable Care Act, Americans having problems paying their health care bills. So the question is, even if the Affordable Care Act gets renewed and extended, what's the next step? Because will still have lots of problems, I think. I'm no healthcare expert, but you are. What do you think? And what
Yes.
is the next step?
Yeah, great question, Brad. Yes, even, if we get best case scenario, we get an extension of the tax credits, we preserve folks' premium affordability. You're right. The system has so many problems, and there are quite a few other areas that will require legislative intervention. I do think that one of the next biggest areas for concerted policy attention will be addressing the rising costs of prescription drugs. So many Americans are unable to afford their regular prescriptions, and that has a huge impact on their overall health and quality of life. So I think that's going to be the next problem that we tackle.
Okay. Natasha, unfortunately, that's all the time we have. I thought, though, you were very informative and interesting, which means we're probably going to have to drag you back to the show. And if you've already, maybe you don't want to after this half hour, but we'd like to have you back. And I'm speaking for our executive producer, Mark Omaldi, who I want to thank for keeping this mess together every week. I also want to thank both our guests, Natasha Murphy, health policy director at the Center for American Progress, and also our first guest, immigration activist and attorney Kate Lincoln Goldfinch. Holidays greetings. Miss the very best. Holiday greetings from Deadline DC. Miss the best and aggressive progressive online must see TV at your own peril.